Hey guys, Connie here. I am now 3 weeks post-op from my mommy makeover surgery, and I wanted to give you an update because just now I came back from my 3-week follow-up and my suture removal. So lots of things to tell you about and also show you. So first of all, I wanted to show you, I had to size down again my compression garment, and this one's a little different than the other one you're used to seeing me wear. So if you recall, I started out in a medium size garment, and then within a week I went down to a small size garment, and at my appointment today she wasn't happy with the small size garment. She thought I could go smaller, so she squeezed me into this extra small garment. And this one's a little different. It's not the same kind of like stretchy spandexy neoprene material. This one's more of like a meshy material. And the thing that's great about this one is it's not long to the knee anymore like my other one was. My other one was all the way down, and it was kind of cutting into my legs a bit because I guess my waist size was different than my thigh size. But I found that material a lot better on my old one. This one though, it's a bikini cut, which is nice, so I don't have to have something down to my legs. So this might be a little bit more discreet. Maybe I could start wearing my leggings again. But this one's kind of annoying because it's all clasps here, and there's no longer like a hole from front to back. It's covered, and it's clasps in the middle. So every time I go to the washroom, I have to undo those clasps, and because it's so tight, it starts to roll up, which is really awkward, and it's like really hard, especially being a tall girl, to like get those clasps back on in between the legs. And as of right now, there is no way that I would be able to do these side ones by myself. I wouldn't be able to get my arm with my new boobs over, and I wouldn't be able to pull it tight enough to do those myself. So she helped me, and my post-op nurse helped me put this on. It's on the tightest setting on an extra small garment. And I literally feel like a stuffed sausage right now. Like even my and I'm not even a hip person, but like I feel like my thigh and like hip fat is spilling out, and I've got like all kinds of side boobage and like armpit fat hanging out, which normally I don't think I suffer that bad from. But in any case, compression is key. I can't say that I feel uncomfortable. Like the compression is feeling really good on my stomach. And apparently this is what they want, is to see nice smooth lines, no creases. And this is gonna help with forming my shape, and it's gonna help keep the level of tension and pressure that I need. So just wanted to give you guys an update that pressure, compression is apparently key at this point, 3 weeks post-op. And don't be surprised if you end up squeezing yourself into a garment and a size that you never thought was possible. Same with the bra. Like they want me to wear the she-fit one as much as possible, and they want it tight, and they want my boobs up. So this has been done up very tight for my liking, and the straps have also been done pretty tight and jacked up so that the breasts are jacked up. So I just wanted to give you guys a view of sort of how that's looking. So now I'm gonna go sit down because I'm absolutely exhausted. It was a 2-hour appointment today for suture removal and for my 3-week update. Sorry, I'm just catching my breath because I've been out and about. I drove to Scarborough and back, and it was a 2-hour appointment, and even just getting used to this tighter garment, man, they really don't want you comfortable in these things, but I guess that pain is beauty, right? Okay, so 2-hour appointment for suture removal. I didn't watch while they were removing them because I'm a fainter, and that just wouldn't have been good. Nothing was painful. You don't really feel anything, but it was a lengthy process. Like the appointment was way longer than I thought it would be, and she literally pulled out like individual stitches, and I don't know exactly where she pulled them from, but I would imagine that they came from all around my breasts, all around my stomach incisions. And she took her time, and she did a very good job. Nothing was painful. It was more just, I guess, awkward, like having someone like over you for like over an hour pulling out every individual stitch. But they did a very good job, and she checked and rechecked to make sure she got all the stitches. And she told me it would be normal and fine, like if I notice a stitch, like even like leading, like in over the next few weeks, she says I can just go to my doctor or a Lynn nurse to have it removed, or I can go back to Scarborough if I want, because your body may, push out stitches over time too. But as far as she saw, she got them all. The awkward part is when they do your belly button. And so Like, she's literally fingering my belly button, like getting her finger in there, opening it up, removing the stitches, feeling for stitches, picking at them, like removing the stitches. So what I will say is my belly button looks like more open now that the stitches have been removed, which is good, because thought it was looking a little small. It looks like an upside down heart, my belly button. It's actually really, really cute. But it was looking really small. So I mentioned it to her, and she did tell me that once she removes those stitches, it would open up, and she literally like fingered my belly button and like opened it up more. So once again, that didn't hurt, but it did feel, I'll say, kind of awkward movement. And when people touch my stomach, like it almost feels like whoop, 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 like hollow and like watery, I want to say, underneath. So she said that's normal, and she says that that's like sign for like needing to go for my lymphatic massages. So they want me to continue doing that or start doing them. She had me feel my back, and I definitely have like, we'll say, some lumpier areas on my back from the liposuction, which is once again normal, and once again will smoothen out, and once again why lymphatic massages are so important, and also having this really, really tight garment that goes right up my back. So that compression even on my back still is very important for helping smoothen. It seems like in general, like my right side is dropping and fluffing and smoothening out better and faster than my left side, which she says, what side's your dominant side? And of course my right side's my dominant side, so that's probably the side that's getting worked more, which is probably why it's fluffing better. So goals moving forward is to just lymphatic massages to help smoothen the lines out, and also compress to try to reduce the swelling and really help create some shape and form in my body. But otherwise, they're very happy with how things are healing. They want me to pay extra attention and allow my breasts to heal. They removed all the steri strips from everywhere, and my stomach incision is looking great as everywhere else. But with my breasts, she said they're still, not 100%. So they've removed the steri strips, but they want me to be really careful with them, and they want me to go back to dressing my breasts. So she wants me to start covering the nipples again with a dressing, and underneath the breast with another dressing, just to kind of protect those areas. And honestly, it's a good idea with how tight this bra is right now. Like, I can't believe they want it this tight and your boobs jacked up this high, but that's what they want. So I know they look really different today, and they look crazy fake and in my neck, but that's how they want them right now. So they haven't even told me to switch yet to the underwire bra. I thought they were going to ask me to start switching to the underwire bra, but she said no. They want me to give it another 2 weeks. So I'm stuck in this sports bra for another 2 weeks before they're ready for me to start using an underwire bra. And actually, even when I start the underwire bra, she says it'll probably be an underwire bra plus the sports bra over top. So I'll be wearing 2 bras when the time comes, but it's not yet, probably in a couple of weeks. I am not allowed to do any kind of scar cream yet on my incisions. They're still too fresh. So they will give me the thumbs up when I'm allowed to, but they still think might be another couple of weeks. They want me to moisturize my body more, especially like beside my breast where there's no incision is very, very dry. I'm sure wearing this compression garment all the time doesn't help. So it's really important to like hydrate your skin and moisturize your body, especially these areas that are compressed all the time, so that you're not having like a dry skin issue. So I'm going to keep using bio oil and moisturizers on my body, and I have to make sure that I get these areas on the sides of my breasts. You can't put moisturizer on the incisions, but you should do all the areas around it. So I'm going to need to do a better job of that. Yeah, so what else should I tell you? So suture removal, healing well. Oh, they did light therapy on me. So after they removed all the sutures, they asked if I was in a rush, which I wasn't, and they put me under this like special light for like a good like 16 or 18 minutes. It didn't feel like anything. It felt like I was in a bit of a tanning bed, but they put it like really, really close to you without it touching. And she just did it on my breast because they wanted to give it some extra help for healing. So that was an interesting process. Hopefully it helps. They also gave me, and I think I left it somewhere, and I'm too lazy to get up right now to show you, but they also gave me like a special cream to start putting on my breasts on certain areas to help them heal even faster. I don't have any open wounds. Everything's healing really, really well. But once again, just to reiterate, like I had a lot of work done on my breasts. Like I had a pretty large lift, a very large like nipple correction. Like I had massive areolas that were made much, much smaller. I had like a reduction in one to match the size to the other. And then I did put in a very large implant, a 525cc implant. So my breasts were always the big job of this mommy makeover. So they're just paying extra attention so that I have the best possible results with healing, and I'm going to continue following their orders so that I maintain that. They're really great by giving me this new extra small garment, and they even gave me another extra garment, a size even smaller, for probably within the next week or so. I'll monitor, because this is an extra small garment and it's on the smallest hook setting, and she seems to think I'm going to need to go smaller in the next little bit. And I don't have another appointment with them until 3 months post-op, so she just gave it to me now, so I'll hang on to that for when the time comes. I cannot fathom wearing anything smaller at this point. Like, I'm having a hard time breathing as it is in this extra small garment. I mean, I can breathe, but like, you have to catch your breath every once in a while, especially after I just had dinner. So yeah, guys, that's my 3-week what to expect from your 3-week post-op follow-up with your surgeon's office. I didn't actually see Dr. Kara today. I just saw my post-op nurse, who was amazing, by the way. But apparently at my 3-month post-op, which is going to be my next actual appointment at their office, I'll be seeing Dr. Kara himself, as well as my plastic surgeon consultant. So it'll be a really fun one, and I'm actually doing it on my birthday. So in April, I'll be back at Dr. Kara's office, if all goes well, for my 3-month post-op. But in the meantime, I have access to them, and I'll have regular phone calls with them, and I can send them pictures and updates and ask any questions I have. And if for some reason something comes up where, you know, I need to go see them, then I always have the option to go and see them. But if it's something minor, like a new stitch has, you know, become apparent, then I can even go to a family doctor to have that removed. And I'm just going to now keep an eye on all of my incisions, especially because they just took off those steri strips and removed those stitches. So I'm going to monitor that. About the tummy scars, so the tummy scar is looking really good. You'll see that some areas are already flattening out, whereas other areas still have a bit of a bump. She told me don't worry about the bump. It's not going to heal that way, that the bumps will flatten over time. So she was showing me the areas that were already healing really, really well, and then the other areas where there's a bit of a bump on the scar, and she said that don't worry, like those will flatten in time. And there was really no concerns about my tummy tuck incision. It's looking really good, very clean, dried out. And honestly, like, I have no complaints. I've said it from the beginning, the tummy tuck has been way easier than the boobs, and the belly button actually looks really, really good now that the sutures are removed. So I think I won't be able to put this garment back on myself today. I was going to shower when I came home from this appointment and whatnot, but my husband's working late, and there's no way I can do this by myself. So I'm just going to call it a night tonight, go to sleep all stuffed like a sausage like this, and maybe tomorrow I will attempt with him to take everything off and take a shower and maybe take some pictures of how things are looking. So anyways, guys, I just wanted to give you that update. Have a great night, and this is 3 weeks post-op. Thanks.